started. I know a few of you are still finishing up, but with your permission, we'll get started. I'd like to introduce Ken McInturf, and Ken will give you a little background on Dr. Thompson. Ken McInturf.
Ryan Thompson, MD, is a board-certified family physician who has been practicing in Calaveras County for 41 years. He graduated with honors from Chicago Medical School in 1985 and subsequently completed his family practice residency at the Memorial Medical Center in Long Beach in 1988. Though he has always treated individuals with ADHD and autism, his interest in this disorder became heightened with the discovery that his son struggled with both conditions. Living in a rural area made it extremely difficult, if not impossible, to access the comprehensive services for his son. In spite of the multiple attempts to foster development of such needed services, adequate help was not found. With the help of his wife and other trained professionals, the Mind Matters Clinic was developed to meet these needs. Through specialized training and practice experience, he's become the area's expert in assessing and treating ADHD. Oh, I'm sorry. Sorry about that. His approach is unique in that services provided are truly comprehensive, utilizing medical, dietary, and non-traditional methods, which combine to provide the most effective treatments available in the region. Over the years, he has provided educational seminars and consultations for groups of professionals, educators, parents, and public organizations while promoting effective treatments and hope for these individuals. It is a great pleasure for me to introduce the Executive Director and Founder of Mind Matters Clinic, Ryan Thompson.
Okay, you've already seen the first 3 slides, so let's get past that. Thank you for all for coming. Can you hear me okay? This thing's kind of weird, isn't it? Hear me in the back? Okay. Can you see me in the back? No, you can't. Okay. Okay. As Ken said, I'm Dr. Thompson, and I'm the director of Mind Matters Clinic. And I'm here to give you a little information about autism and try to do it all in 30 to 45 minutes as a challenge. So we're going to go through things, and at the end, hopefully, if there's questions you have, you can ask the questions. And I will try to give you as much information that makes sense to you without overloading you at the same time. So with no further ado, let's try the button. Let's try it. Oh, I think I know that one. Okay. What is autism? Autism is actually a spectrum of disorders, which means there's more than one diagnosis within an umbrella of different diagnoses. And so it's not just one thing. So when you say my child or a friend of mine has a child with autism spectrum disorder, it's going to be different things, and so they're going to appear different depending on the type of disorder they have. And even within certain disorders, they're going to have different variations. Some are going to be more severe in some areas, and some can be more severe in others. And so they all look a little bit different. The main types there are, there's going to be autism, which means a child has all of the criteria that they need to make a diagnosis of what's called full spectrum autism. The next one typically would be considered would be Asperger's disorder. Asperger's disorder is like autism without the speech problem. I mean, they don't have a speech delay, but they have all the other features of autism. So they can be, look very intelligent and speak very well, but still have all the other features of autism. And I'll explain what autism looks like otherwise. The other one that's commonly referred to is what's called PDD-NOS, which means pervasive developmental disorder. And it's kind of like autism without enough features to make one of the other 2 diagnoses. So it's enough impairment to have the diagnosis of being on the quote-unquote spectrum, but not enough to be included in one of your 2 categories. So in ways you can kind of see it as being autism-like. not quite as severe usually. Even within that, though, if you have very severe impairment in one area and less in another, you have the PDD and seeing more or less impaired than somebody with behavioral disorders. The other two we're mentioning, Rett's disorders and childhood disintegrated disorder, they're pretty uncommon, but they're pretty well known for being exceptionally severe and also known to have a genetic cause. So those are the basic types you see. So what are the characteristics of autism? Part of what I think about a talk like this is most people really have kind of a fuzzy idea of what autism looks like. It's a relatively new disorder for people in the community to know about, so you really don't know what you're looking for. When you think of autism, what do you think of? And that's what I'm trying to describe to you, okay? There's three basic kind of clumpings as far as diagnostic categories. First one is impairment in social interactions. And that's one that's most noticeable because if you see a child with autism or a person with autism, they're going to look and act differently. They're going to look odd. They're going to be strange. And so when you see them out in public or doing things that are social, you'll notice that they look odd or different, but you don't know why. So oftentimes people who have autism, when they're seen by other people, they think they're just misbehaving, that they're being rude, they're being insensitive, they're being things like that because they don't get it. They don't get the concept of what being social means. Basic things, poor eye contact, that's a common one you kind of notice when you approach a child or an adult with autism. I saw an adult yesterday who we just diagnosed as having autism. He's 57 years old. He's lived his whole life not knowing he had autism. But one of the most notable characteristics when you see the guy, he's sitting across the desk from me, is he would, off and on, he would kind of look at me, but he wouldn't really know why he was looking at me. You could tell after 57 years, somebody's been telling him, look at people, but he didn't know why he's looking at me. So you can tell that usually when you're looking at somebody, when you're talking, now when I'm talking, I'm looking at people's expressions. I'm saying, are they getting it? Are they doing the head nodding? Are they letting me know that they're understanding what I'm saying? So they're communicating back and forth to me. And that's important to do, we all know that. But who in their life really had to be taught that? I mean, when's the last time a mother sat down with a child and says, it's important to understand other people's emotions and thoughts by the way you look at their face and what their eyes are telling you. You don't have to do that. That's a natural life experience that you all develop innately if you don't have autism. If you have autism, you don't get it. You look at the eyes, and you could be looking at their nose or their forehead or any other part of their body and get the same signal, because there is no signal. So they get taught oftentimes, the parents will always do the look at me when I'm talking to you. And oftentimes they'll take their face and go, and they force the child to look into their eyes, but the child, as they're looking at their eyes, they kind of wander. They're looking kind of at the nose, maybe a piece of spinach in their teeth or something like that. And so yes, they're looking at you, but they don't know why. It's a very important thing because if you're missing that, you're missing a lot. 80% of nonverbal communication is communicated through the eyes. So if you're missing that, then you're missing these huge pieces socially. You don't know what people really intend to mean, how they're responding to you if they're bored. Like right now, if you start getting bored, I'm going to notice that. Okay? Okay, don't give me that eye, because I'll see it. Okay, I'm not autistic. If you are autistic, you don't get it. You don't see it. So you keep talking right over people. Lack of facial expression. It's not just lack of facial expression, it's sometimes the inappropriate facial expression. I have another autistic patient that I had. He came in, he was 19, we diagnosed him when he was 19 with having autism. His father didn't know why. But he had 3 facial expressions, and he would use them in routine. He would always do the wrinkle lines on his forehead, because he always did that. And then he'd go, and then he'd go. So he had three different expressions, and he used them randomly throughout the conversation. Had nothing to do with, I was in the middle of saying something, and he'd go, and I just keep watching this and kind of going, obviously he's not getting it, but he somehow had to learn this pattern, that somehow he's showing interest by doing those things. Now, if I just walked up to you and said, my mother just died, is that a good time to use that expression? Well, no, but that's what this guy does. I could be talking about something completely serious, and he keep doing raising the forehead and do the thing like this. So it's a nonverbal communication, it's a facial expression that they don't know what's appropriate when. Because even if you try to model somebody, if you tell a child to say, you should smile when somebody compliments you, well, what kind of smile is that? You know how many smiles there are? There's a little smirk kind of a smile, and then there's the broad grin when you're really excited about something. Okay, there's going to be a different time when you do those little smirks versus those smiles. To a child with autism, one smile equals another. So they don't have that ability to kind of modulate between a little smirk and a, okay? Same thing with everything when they laugh. They can have this laugh that is completely inappropriate because it's the wrong place and the wrong time. If you tell a child to say, use your indoor voice. Okay, if you're indoor and you're at a basketball game, do you use your indoor voice? Well, nobody's going to hear you, of course not. Okay, when it's okay to speak loudly. Okay, it's okay to speak loudly when you think something's funny. It's okay to laugh hard when it's something funny. What is something funny in the front row of church? Is it a good time to laugh right now? No, not a good time. Wait a minute, you said it was okay to laugh when it was funny. Okay, so we got a problem there. But how do you discern those differences? Now, again, for people without autism, you know the difference. You know when it's time to smirk, when it's time to laugh, and when it's okay to have a belly laugh. Now, if you have autism, you have trouble with that. Limited pure relationships. This is where this is more the thing you usually find with kids, that they can't make friendships. Because, again, they don't have the idea of how to be social with other people. They tend not to know how to read those signals, then they don't know how to respond. If you're showing me you're bored, then I should do something, right? Like I should dance or something to make you wake up, or I should change the subject so I know how to respond. So kids with autism don't know how to respond to those signals, so they don't have success in making friendships. They don't know how to approach people. They don't know how to engage them in a conversation. So sometimes they'll say, I'll ask a parent or an educator, I'll say, how does the child do socially? Oh, he does fine. Well, why don't you describe it to me a little bit? Well, he kind of prefers to play alone. You know, most first graders like to play alone. You know, so he goes out and sits under the oak tree and gathers acorns all day when it's recess. Well, is that a socially acceptable person? Well, it doesn't bother anybody. Okay, well, I guess that's good it doesn't bother anybody, but does that mean he really has a friend? So if you ask them, you say, who is your best friend? Rodney. Oh, okay, Rodney's your best friend. I can take it as face value and say he's got a friend, right? Rodney. Well, can I get some about Rodney? I say, tell me about Rodney. What's Rodney's last name? I don't know. Where does Rodney live? I don't know. What do you do with Rodney? Well, sometimes Rodney comes and takes my lunch. Was that a good friend? Well, no. Sometimes I like to talk to Rodney about my video games. Well, you talk to Rodney about video games. What does Rodney do with you? And you know, as a parent, you say, tell me about Rodney. That's your son's best friend, right? I don't know who Rodney is. Who's Rodney? So they go through this thing. So if you don't ask the second question, oftentimes you don't find out do they really have friendships. You know, the hard one is, you know, kind of the one oftentimes you brings things home is you have a child who's middle school years and you say, how many birthday parties has he been invited to in his life? You know, maybe one. They were being nice. You know, they allowed him to come along. It's a very sad statement, but sometimes that's the one that's most impressive to a family member, to family people, to try to let them know, you know, that's kind of unusual to never be invited to a birthday party. It usually means there's something wrong socially. Lack of social emotional reciprocity. Again, that's that same sort of thing. If you don't get what people are telling you, either verbally or non-verbally, you don't know how to respond. When is it appropriate to laugh? When is it not appropriate to laugh? What's cool? Can you define cool? We all know what cool is. When you're a teenager or you're, you know, after about the second or third grade, you start getting what cool is. If you have autism, you don't have a good read on that because you're not reading what other people are responding to. So you don't know what cool is. Is it okay to cry in class? Well, in first grade, it's probably fine. How about if you're in fifth grade? That's not cool. That's going to lead to you getting bullied, getting victimized, that sort of thing. But if you have autism, you don't know that. You don't know what that will mean to you later as far as your peers around you. They'll start to distance themselves or they'll start to harass you because you've done that. Communication impairment, this is kind of a hallmark of kids with autism without Asperger's. So oftentimes kids with autism develop speech late. There's a frequent thing when people say they take their kid to the doctor, my child hasn't been speaking, he's 2 years old, is that okay? And of course doctors always want to be reassuring, because they're kids. They'll say, oh no, he's a late talker, he's a late bloomer. Oh, he's the second child, second children never speak like the first child does. You're not making him speak. So we go through all these sort of gyrations as physicians to try to reassure parents your child's fine. But if they're not speaking sentences by age 2, you've got to be looking for a problem. If he's not saying single words by the first year of life, you've got to be looking for a problem. Don't be easily dismissed at that point. You can't just be easily reassured, and a doctor shouldn't just easily dismiss it. But every doctor on the planet who sees a mom, especially a new mom, come in, they know they're neurotic messes. So they just want to say, you're a neurotic mess, it's okay. All right, go home, you'll be fine. But it's not. And that's how a lot of times we miss the diagnosis early, because we miss the diagnosis early, because we're not paying attention. Obviously autism become a lot more notable, so people start paying attention a little bit more to it, so it's helpful. Inability to sustain a conversation. Again, this is kind of an interesting one, because you'll ask somebody, okay, are you able to have a conversation with your son? Parents are wonderfully patient with their children with autism. Their child will talk endlessly about something that fascinates them, but that you have no interest in. And that's not always abnormal. You can have a child who's interested in something you're not terribly interested in, but if it goes 10, 15 minutes and they're still talking about some minutia, about some trivial thing you have no interest, and you've turned your back, you're walking out of Mitch used to do that. Okay, 1 minute story. You do the good night story with Mitch, and then he starts talking to you about rattlesnakes. He wants to know about rattlesnakes, all the facts, the who, what, where, why questions, okay? It's called downloading information or asking factual information. So he would start to ask the who, what, where, why questions, and I'd say, it's time for bed. Mitch, rattlesnakes, I've seen 2 rattlesnakes. Where? What? How long were they? Were they teenagers? I don't know how teenagers how rattlesnakes look, but no, they weren't teenagers, okay? No, just shut up. I'm leaving the room. I'm leaving the room, Mitch. I am leaving the room. What's happening? I'm happening down the stairway. What's the longest rattlesnake you ever saw? Mitch, I'm gone. I'm in the shower now. You're still asking questions about rattlesnakes. Okay, is that a conversation? No, it's not a conversation. So that means they're speaking to you. And parents are so good about being patient that they miss the cue that, wait a minute, didn't you notice I just left the room? Does he notice I'm not interested? Do his friends not notice they're not interested? Do they want to know about Pokemon anymore? Okay? I hate Pokemon. I've never even seen them, but I hate them. These kids come in all the time, they share all about Pokemon. I don't care. I'm done with them, okay? But they do it so much, you just like, oh no. And if I'm doing that, what are his peers doing? Okay, peers pick up on those things a lot faster than parents do. Parents are a lot more patient than peers are. So the measure of success of a peer relationship is a peer, not a parent, not an educator. So if an educator says, oh no, he does fine with the kids. Oh yeah, he goes boars to hell and we're talking about Pokemon for the last half hour. Is that a successful relationship? No. So you've got to find where the peers think of them. Okay? Odd or repetitive use of language. That's part of that. They can have their own language. Some kids are nonverbal when they have autism, which means they don't speak at all, or if they do speak, they speak in their own language, using kind of funny terms for things. But sometimes what they use are either an odd intonation, the way they speak, like a little professor kind of a voice, because they're always going to be expressing exactly the same sort of monotone, no matter what they're talking about. Or they have difficulty with modulating their voice. Again, how loud, how expressive do you talk about something? How softly, how robustly do you do that? They don't have a good sense of that because, again, it depends on the circumstance. So if they can't sustain a conversation is you listening long enough till you can jump in and say something you want to say. That's really the point of a conversation. And so if you don't get that, if you don't know the other person really is going to want to participate, then you talk too much. I mean, I know some people without autism do that too. I do that sometimes. But if you don't ever pick up on that clue, you talk too damn much about something that interests you without saying something to somebody else. I like climbing mountains. I'll talk to people about climbing mountains. But if I keep talking and I never invite them in and say, have you ever climbed a mountain before? Because I'm inviting them into the conversation. I'm going to let them share one of their interests. Okay, that's the other half of the conversation you have to do. Restricted or repetitive patterns of interest. This involves kind of the areas where sometimes you have a very specific interest, like a child like Mitch loves animals. He can tell you all about certain animals. He can tell you, what their habitat is, how many of them are there, how big are they, what's the average, You become very, very specific, very zeroed in on certain things. Dinosaurs, World War II aircraft, For having a 6-year-old child that knows something about World War II is cool, that's great. But what if they know about every World War II aircraft ever made? They know what the horsepower of the engine is. I had a child who came to me from Sonora he loved roof vents. He's 4 years old. He knows all about roof vents. Anybody here know anything about roof vents? I found out about roof vents. He told me all about roof vents. You know the different sizes. You have 4 inch, you have 6 inch, you have the ones with little vents on the top, flap like that. If you have this down here, he's 4 years old. He knows everything about roof vents. How about pool cleaners? Is that a fun one too? Everyone about pool cleaners? Hey, I got a kid I can send to your house, okay? He'll tell you about pool cleaners. He knows everything about pool cleaners. Okay, is that a functional interest? I guess you want to be a pool cleaning man, would be. But it's not necessarily vacuum cleaners. That's another favorite one too. How many vacuum cleaners are there? How many brands are there? How big are they? How much suction do they have? Oh boy, this is what I want to talk to my friends about school. Hey kids, get on the road. This kid knows about Hoovers. So that's not something that's going to get you very popular. Okay? Repetitive manner of rigid adherence. This is where sometimes you see behaviors which are very disturbing, annoying, startling. Kids with autism like to have things in a certain order. They like to do things in a certain ritualistic kind of a manner. And if you try to disrupt that, if you try to reverse that, if you change the expectation on them, they go ballistic. And it's not just a little bit peeved. It's not a little annoyed. They can become very, very upset. They can be, it's like an immoral attack to change their pattern, to change what their expectation was. Today we're going to go to the dump, and after that we're going to go to Rite Aid to pick up some ice cream. What if we go to Rite Aid first to get ice cream? It could be terribly upsetting to a child with autism. They could get very upset and look like a spoiled brat. And you as a parent or the grandparent, look at them and say, there's a spoiled brat. We're just going to have to pound them. But the more you try to pound them, the worse it gets, because it's a very, very disturbing thing for them. They have to have things thought out ahead of time. If you say dinner's at 6 o'clock and it's 10 after 6, or we're going to do it in 5 minutes and it ends up being 10 minutes, what's the big deal? Parents lie all the time. You know how stretchy a little while means, right? But to a child with autism, if you said it was 6 o'clock and it's 6:02, they're upset. They can become very, very obsessed about these kind of things. So when you see that, sometimes you have to back up and say, okay, what landmine did I just step on? What expectation did I just tweak into his head that made it very upsetting for him? If you can get to that, then you get to the problem, you're going to get to the emotional problem. If all you do is try to squish it, like being the authoritative father, like me, then it's not going to work. All you do is make it worse. Preoccupation with parts of objects, that's just something briefly, it's things like if you give them a toy car, and all they're fascinated in doing is spinning the wheel on the car, but not using it like a car. I have a child that turn upside down the bicycle. Upside down the bicycle? Did I just say that? I don't think that was grammatically correct. Turn the bicycle over, brand new bicycle, and then spin the wheel around. And then just stare at the wheel. That's not how you're supposed to use a bicycle, right? But this child was fascinated. That's the kind of things that become fascinating. Things whirling around, staring at lights, playing with water, just turning on the faucet and then playing with the water as it comes out through your hand. It's called self-stim behavior, which goes along with what's called sensory seeking. There's sensory processing disorders. That means children with autism oftentimes are either repulsed by or attracted to things that are going to stimulate parts of their body. And that can be touch, it can be squeezing, it can be a sound that they like or a sound that's very annoying to them. It can be a light, bright lights, that type of thing. Certain textures like clothing, a certain type of a sock. I have a young man that came in last week. He wore blue jeans for the first time. He's now 10 years old. He could never put them on before that because the sense of the blue jeans against his legs made him ballistic. And of course, the mother before that used to like wail on him because he wouldn't wear the clothes she laid out for him. She had no idea what the problem was, you know, because he's going, I can't stand this. Oh, you spoiled little crap. Put on your pants. Come on, go to school. Get over it. Well, they can't get over it sometimes. It's very, very difficult. So that's a sensory thing. When I talk about treatments, digestion becomes important because it's one of the things that oftentimes kids with autism have. They have very weird digestion. Is everybody eating already? Can we talk about poop now? Is it safe? Okay. Kids with autism oftentimes either have diarrhea or constipation, a lot of bloating, a lot of belly pains, things like that. And that's kind of the clue sometimes is to saying, is there a cause that's related to digestion that may influence autism? So it is a common thing. Probably 80% of kids with autism have a digestive abnormality if you ask about it. I won't describe the poops, okay? I'll say that later. Seizures, much higher rate of seizures in kids with autism, usually those that are most severely impaired. When I was a resident, that was one of the things you kind of expected all kids with autism to have. That's not really true. It's more true than the normal population. Learning disabilities, many kids with ADHD and autism have learning disabilities. So that's part of what we do with the clinic, is saying that since that's a part of what we see frequently in this population, it's something you need to address. ADHD by definition is not supposed to be part of the diagnosis of autism, which is kind of laughable because it's so commonly a part of autism, that you really should be able to diagnose both of them together because a lot of times they have ADHD features. Some people think that autism is on the same spectrum with ADHD. That kids with ADHD actually have the mildest form of autism. Mental retardation, again, most severely impaired kids with autism may have mental retardation. So how common is it? This is always interesting. I think everybody wants to know this kind of stuff because it gets a lot of airplay. So here's some good statistics for you to chew on. 1980, 3 to 4 individuals per 10,000 had autism. By 2010, we're down to 1 to 91 to 111. That depends on the state you're in, by the way. Minnesota is the worst. Interesting about in Minnesota, they have a lot of Somali refugees, and they have a much higher risk of autism than Somali refugees. Why? I don't know, but it's an interesting piece. So right now, it's 1 in 137 females have autism, 1 in 87 males has autism in the United States. So that's a tremendous increase. You see 273% just in a 10-year span. It's gone up another 57% in the last 4 years, or 10 years, whatever that is. I think I miswrote that. Sorry, that's 2006. Anyway, so there's been a 20% population increase in the same period of time, and we're having 273% increase in the diagnosis of it. And the most recent mailing from the Center for Disease Control said it's an urgent public health concern. So it's not just, rabid autism advocates that are out there saying this is a problem, the CDC is saying it's a problem. Now, the question is, if you fall asleep on me, you'll have to leave, I'm sorry. Lunch. Question is, do you have more autism or is autism more easily recognized? And that is a good question. The answer I have is it's both. I don't think it's going to be one or the other. So there seems like there's two camps that say it's just being recognized more. There's no true increase in the number of kids with autism, or it's entirely this rapid increase. Is a 273% increase entirely new cases that have never been identified before? It's going to be both, because there is a parallel increase in the number of severely affected individuals with autism along with a parallel increase in those with milder cases. Milder cases are being identified more readily than they were before because we're better at finding them. There's been an increased percentage, relatively speaking, to the milder forms. But again, it doesn't explain the increase in severe forms of autism. You wouldn't miss a severe case of autism 20 or 30 years ago. They're obvious. So you're not going to miss those. So there is a true increase, and there is an increase in identification. Kind of no matter how you slice it, when you get down to these kind of numbers, when you say it's less than 100 kind of kids who have autism, you got a problem. I mean, there's going to be this tidal wave of kids who's coming down the road that have autism. They're going to leave the schools where they get most of their services now, and then they're going to end up going out into the world. And you're going to have this huge influx of adults with autism entering our workforce and our communities, and where do they go? Where do they go? Graphs. So this is saying, there's this question of saying, do we just identify more kids who have disabilities, including autism, and is that an explanation for the increase? Okay, you can guess which line do you think is the autism line? Okay. The red line indicates the cases, the cumulative growth of autism cases in the United States up until 2003. The blue line at the bottom, that's the identification of the number of kids with other disabilities. So you can see it's kind of a flat line. There's a little bit of an increase, but there's also an increase in population. So you see the kind of a flat line for all disabilities versus autism, which sweeps up. Now this is a graph which compares the map of the United States for 3 different time periods, 92, 97, 2003. I don't have anything close, newer than that. But obviously the white ones mean that at that point you have less than 5 per 10,000 population. And then you see with each map you have this massive increase in the number of kids with autism. See Minnesota with the brown up there? Ever recommend Minnesota, Maine? Don't move there. Whatever's there, you don't want it. So specifically for California actually has the best data of any state in the United States, because they're the first ones to start tracking autism related to other disabilities in the United States. They have the best tracking system. So it's not unique to the United States, it's obviously happening in California. The blue line is going to be the number of kids aged less than 6 that are being identified with autism. So again, you see this continuous increase in the number of cases. So what does cause autism? That's kind of the $60,000 question. Part of that is going to be, I'll tell you right now, I don't know. There's a lot of research, and we have a lot of clues. We really don't know. But I'll tell you more about what I do know. Many genes are known to at least contribute to the risk of developing autism. But it's said to be most of the time it's a susceptibility to autism, doesn't dictate whether or not you get autism. The biggest clue to that is that you have monozygotic twins, which means 2 twins born of the same egg, who have the same exact genetic information. 60% of the time, both of them will have autism. So it's entirely a genetic disease. You should have 100% virtually of the children both having autism. 6% of kids, if you have one child with autism, the chance of you having another child with autism is 6%. That's higher than the rest of the United States. It's higher than, so you have a higher risk, but it's obviously a lot different. 9% of cases do we know are caused by a genetic link. Of all the chromosomes, all but 3 have been found to have some genetic piece which might influence development of autism. So there's a massive number of genetic things. There's a few which are more common than others. And you can find some clusters of things that cause autism, but there's not one really clear genetic piece that you can say describes even half of autism. So there is a genetic piece, but it's not going to be well explained just by genetics. So what are some of the other environmental risk factors? One is going to be maternal. We know that mothers who become infected, especially with certain viral illnesses, but also bacterial illnesses, have an increased risk of developing autism in their children. Drug exposure during pregnancy, mostly something called valproic acid, which is a seizure medication, is known to cause an increased risk of autism, so we know it's a toxic thing that can do it. prematurity. There's a much higher risk in very low birth weight infants, it's called, which means children less than 1,500 grams. Very small babies, they have a higher risk of autism, which makes you think that could be a brain injury kind of a thing, which is also the oxygen deprivation at birth. So they have what's called fetal distress, means at the time of birth, the child struggles, that they have an increased risk of autism, probably from lack of oxygen. Epigenetics. Kim made sure that I want to tell you what epigenetics means. It's kind of a buzzword because it's interesting in that people are now researching if you have genes and the genes can be modified to either increase or decrease their activity, that's thought to be an influence in development of autism. If you have a susceptibility to having autism and then something comes along and tweaks your genes to either increase or decrease the activity of that gene, then that might manifest or show up as being autism versus not. So at some critical juncture in development, either as a fetus or as an infant, something happens to tweak that genetic material, to change it, then that might increase or decrease your risk of developing autism. So you could have the same genetic material in two kids, monozygotic twins, and something comes along and tweaks one but doesn't tweak the other one. So what are those kind of things? What things might those be? And that's where the biggest area of interest is. Autoimmune disorders. We know that there's people with autism have a much higher risk of having a family member with what are called autoimmune disorders. Autoimmune disorder means you produce antibodies against some protein or some organ of your own body. So that means that there may be an immune link to developing autism. And I think that's probably where most of the interest lies. I think that's probably the biggest promise, is that there's going to be an immune abnormality we may discover that may be a more common threat. Because what happens is if you have an activation of the immune system, it can disrupt the development of the brain. They see increase in inflammation in the brains of children with autism. So something comes along, increased inflammation, probably it's immune, and then it disrupts the formation of the neurons in the brain as they're developing. Especially when you see what's called regressive autism. Regressive autism is a very, very notable thing. It's a child who is developing normally. Their speech is normal, they're cruising along as 2 years old, they've met all their developmental milestones, and all of a sudden something abruptly happens and they start to lose everything they've gained. They were speaking, they're no longer speaking. They were interacting with the parents, being affectionate, that sort of thing, all of a sudden they don't. They stop. And it can be a very, very rapid sort of a thing. You'll see it happen over a period of 3 to 6 months where a child regresses. And it's probably the worst form of autism you can see for a parent. Because you have a parent who's bonded to their child, the child's made all these milestones, they're making good progress, and all of a sudden they just see their child kind of falling away from them. They're kind of pulling away, they're falling backwards. And it's a very desperate feeling for a parent to see that happening, knowing there's really not much you can do even once you do find it. Very scary. But the question is, what is that that would be causing that kind of a change? Vaccines. Obviously, there's a lot of debate on as far as vaccine goes. I wish I could tell you it is the smoking gun. I don't think it is. I think that there may be a rare individual who's going to be affected by vaccines, probably because it tweaks something in the immune system for a susceptible individual. Whenever you look at vaccines, you have to say, what's the risk of the disease versus the risk of the vaccine? By and large, the risk of disease is going to be greater than the risk of the vaccine for a child. If you did have one child with autism, though, and the second one comes along, you're thinking about vaccines, it's going to make you think twice, and then you think you should, because I don't think all information is known. Someday, what I hope to be able to find is say there's going to be a blood test, there's going to be some assay, some way of knowing if there's a child who's going to be susceptible to an ill effect from the vaccine. By the same token, if you give a child gets measles and they get brain damage from measles, you can't say, well, that's a good outcome either. So it's a little bit of a balance, and I can't tell you I know exactly. Most large-scale studies don't show a connection between vaccines and autism. But there's an element of the question that's still out there. Mercury, lead, detoxification. Mercury is in thimerosal, which is an ingredient in vaccines. It's supposed to be a preservative. There was a lot of concern as far as it causing autism. It's probably not by itself going to be the cause. But there's this question as far as what are called heavy metals, which include mercury and lead, that kids who have those sort of things with autism have difficulty clearing those sort of things. They can't get rid of those things as easily. And those, in fact, in turn then cause a problem with the brain development. What we don't know is how do you measure that, how do you anticipate that, and then how do you fix that. There is a way of working with that chemically or biochemically through some supplements which may help prevent the body from being damaged from that. And that's one of the things that we try to work with. Pesticides, this is the one that's actually has the best evidence that there may be a cause and effect, sort of a link. They did a study in California, in 11 counties in California, and they measured the risk of autism based on how close an individual lived to an area where they spray pesticides. And if they lived within 500 yards of an area where they sprayed pesticides, they had a 6-fold increase in the risk of autism. So, and it's a certain type of, it's not just all pesticides, it's a certain type called organophosphates. And that's been replicated in 3 different areas in the United States. So pesticides become, okay, in some kids, that really could be the link. How many kids? Don't know. There's 28,000 chemicals produced in excess of 1 million pounds per year in the United States. 20,000 different chemicals. Of those chemicals, 76% have never been tested to see if there's any sort of neurological damage potential. So 76% of those chemicals that are out there have never been tested. So how can you say whether or not they're going to cause damage or not? Don't know. That's a huge number. And you can imagine that trying to test all those things would be a huge thing. We also get 100 new chemicals every year being produced. So are there other chemicals besides pesticides? Something less obvious? Just that number alone is staggering. The gut-brain connection. This is something that's fascinating because, again, kids with autism have weird foods. Okay, they have weird digestion, they don't like certain foods, they oftentimes look and appear malnourished, that there may be something wrong with their gut. The question is, does autism cause the gut problem, or does the gut problem cause the autism? Is there a link, and if so, where do you intervene in the link? I tend to look for those kind of problems in kids with autism and say, let's look and see if we can heal the gut, see if we can find improve the way that we improve their gut function, and does that in turn improve their autism? And you do see it help sometimes. Can I always predict who is going to help? No. Part of the problem because I don't always know exactly what the cause was. Okay? But if there is something you can tweak, you can change, you can fix, then potentially you can fix the autism. Treatments. Now this is by no means an all-inclusive list of things that you can do to help kids with autism. Early diagnosis is essential. If you diagnose a child with autism before the age of 2.5, their long-term prognosis is much better if you then intervene, which is another problem. If you diagnose a child with autism and you go through the system can take months, years to actually start to do anything that changes their lives because it is unfortunately bureaucracy and lack of payment through insurance companies. So even if you diagnose a child with autism, they can wait 6 months, a year before they ever get any kind of intervention. So it's kind of a travesty because you know that's where the money is to start early. Behavior therapies, that's where basically you have a behaviorist or someone who works with children with autism to try to teach them to engage, interact, socialize, communicate, and develop patterns of behavior which are more normal. It's an intensive type of a thing. One form called ABA is something that requires many hours a week. Who's going to pay for that? And that's kind of been a big struggle for most parents who have a child with autism early on. They want these therapies, but nobody pays for them. For very limited funding for it. Dietary changes, a lot of kids with autism are very self-selective. They will only eat certain foods. They have very picky preferences. Sometimes it's because of the texture or the appearance of the food, or the smell of the food, or it could be something wrong with their digestion. Some things actually cause pain for them in their gut. So some of the dietary changes you can make are going to be guided towards general nutritional status. I mean, some kids with autism all eat, I've had kids all eat with chicken McNuggets and string cheese. I mean, can you really eat that every day, all day, and be well nourished? I mean, I talk about all the things you must be missing in something like that. How come they always gravitate towards one of the worst stuff too? Chicken McNuggets? Imagine being fixated on that. I could be one. So doing dietary changes is something that I always try to strive to do. You try to look for the things that are going to help them with that. It's kind of complex. I'm not going to go over details on that. Supplements are going to be guided on what you think might be a cause or something that's influencing the autism. Again, as I was talking about, if you think the autism is related to a food allergy, or it's related to a gut problem, or you think that there's some problem that think you would require detoxification, then there are groups of supplements that you can do to try to help with that. Essential fatty acids in the form of fish oil is one thing I usually recommend. 20% of the developing brain is fish oil, or basically omega-3 fatty acids. Children with autism spectrum disorders have lower levels of essential fatty acids in their bloodstreams. So supplementing with that is kind of a pretty routine thing. I do it for most kids. I don't do the blood test because it costs $350. I just give them the fish oil because it's usually going to help. Beyond that, too much of this kind of a talk about all things that are possible. There's a lot of other things you're looking at. Medications, there is no medication that cures autism. There is no medication that changes the course of autism. There are medications which influence the behavior of kids who have autism. If they have ADHD, treat them with ADHD medication. If they're combative and they're disruptive and they're violent, aggressive, then there's medications that you can do to help with that. If they get fixated on certain things, they get stuck, they're obsessing on certain things, medication can help with that. But they help. None of them are curative of autism. Social skills training. This is one of the more impairing things of kids with autism. If you can't function in a relationship, you have trouble functioning anywhere. Because it's not just a relationship with a wife. We all know reading a wife is difficult even for a normal individual. But kids with autism, forget it. They're not going to get it. If they're in a relationship with their boss, a colleague, a co-worker, somebody else at school, I get it all the time. I just, again, saw this gentleman this week who has Asperger's, and he's been trying to get a job for years. But every time he starts a job, he loses the job. And he never knows why. He always thinks the world's out to get him. But when you talk to the guy, you know that he's missing these huge pieces. When the boss comes in, the boss kind of gives him some thing to do. The boss assumes that what it really means is to kind of do it now, don't do it then, do it tomorrow, do it today. There's kind of the insinuation in the way you say something to somebody that everybody picks up, unless you have autism. If you don't have autism, the boss says, I try to give you an example, they're so concrete. If you say it's black, you better be in as black as a person with autism is always going to see it as black. They don't see gray zones. If you say something needs to be done right away, what does right away mean? Does right away mean get up from the table right now and leave while the boss is still talking to you? Or does it mean sometime today? Which a person with autism, they probably will get up from the table right away and leave. You're still talking. Okay, is that going to be a good thing with your boss? Well, it looks like you're blowing them off. But, he said right away, didn't he? Yeah. So that's how they get it. So social skills training is actually taking people with autism and walking them through the mechanics of how to be social. When somebody says this, what do they mean? If they're responding in this certain sort of a way, what does that mean? How do I know if somebody's paying attention to me? How do I know something is important to do or not do? Just for example, okay, I'm standing here, I'm talking to you, I have a microphone, I'm communicating to you, right? Because I'm looking at you. Is it okay if I go somewhere else and still talk? I can still give you the information, okay, right? You can still hear me. I know you can hear me. You're still out there. But is it okay for me to give the rest of the talk from over here? It feels kind of weird, doesn't it? Don't you wonder what the heck he's doing over there? Okay, but why is that not right? I'm still giving you the information. You still have the stupid slide up there. You put that, right? Why is that not okay? Is there a rule that says you can't do that? Okay, one rule story, okay? I'll tell one more story. Went to the homecoming game, I think it was this year or last year, and I work at the football games every year with my son, Mitch. He's my helper there. And he's always down on the sidelines with me. We're out there for homecoming, and usually at halftime I go in with Mitch usually, and we take care of the injured players. They're always more injured if they're losing. Okay? One thing I've learned about football. Okay? More pinkies are hurt on those bad days. But anyway, I'm in there taking care of the wounded players. And so I come out after doing that, just in time to see all the homecoming princesses coming around the track at Red Heart and dumping off on princesses right there. Of course, there's 800 people in the stands full right there. and I come up and I lean on the railing to see what's going on, and I look out there on the 50-yard line. On the other side of the homecoming princesses, there's this one young man, one person, standing there taking it all in. The best seat in the house. Where else would you want to be to watch homecoming princesses come? I mean, it is great. And who's there? It's Mitch. Hey, Mitch. Hey, haven't hung out there? And for me, I look at that, and I've had to learn as a parent of Mitch that sometimes you have to look at it and say, okay, where's the rule? Anybody know a rule that says you can't stand on the 50-yard line to watch the homecoming parade? Do you see any indication of that? Is there any law? Is there unethical behavior about that? But you should see the people in the stands. Some of the ones that kind of go, rumph. I mean, what parent would let their kids down there in the 50-yard line? I mean, that's wrong. Who said it's wrong? I don't see any rule. So I don't want to give up. I mean, he's not hurting anybody. He's having a blast. Of course, the girl he wanted to win won. So what's Mitch do? And there's 800 people out there watching him on 50-yard. He has no idea that 800 people are kind of going, who the hell is he? Well, I sure am glad that he likes that. I bet he liked that girl. He has no idea that, you know, if I go down there and I take him and I kind of escort him away after a little bit, he has no idea that what he's done is a lot different. Because there is no rule. He's broken the law. So other kids with autism, that's what you see. You say, are they misbehaving, or they just don't get it? I mean, what is it about that that's rule? Okay, one more story. It's just too much fun. Because as a parent of a child with autism, sometimes you gotta have a sense of humor, because it's pretty darn funny. Okay, UOP basketball game. Okay, Kim already knows this one 1,000 times. You go to UOP basketball game and you have a child there with you, 2 kids. My son and another one who is also kind of different. Okay? And so they say, we go down to our seats, and they're right there at the half-court line, about 10 seats up. No big deal, it's a good place. But I say, well, I'm going to go get something. They already have their licorice whips and their Pepsis. They're ready to go. I'm going to wire them all up. Okay? I say, Dad, can we go sit down lower? And I look down, and right there at the very front, you know, in the stands, there's 2 seats, a couple seats. And I said, sure, there's nobody here. Game's already started. So I go back up, I go get my hot dog or whatever I get, and I come walking back down. I look down there, and there's nobody there. I go, where did they go? You know, there's a famous question, where's Mitch? We said that a few thousand times, right? You know, he usually comes back. So where's Mitch? I don't see him. I go, oh man, where'd he go? So I'm looking around, and all of a sudden I look up to look at the basketball game. You know all those folding chairs where all the players sit? UOP players? Well, at the very end of that row, there's 2 seats. And guess who's in them? Licorice whips and Pepsis. Wow, what a cool place to watch a basketball game. And can you imagine what the other 3,000 people were thinking? Who the hell let their kid go run the seat like this? And as I go, I'm going to go run down there on the seat. I'm like, oh, hell no, I'm not going down there. They might go, I'll just sit here and wait for after. But then I finally overcame and I had to kind of go down there and escort him away. He had no idea. Mitch, you can't sit here. Why not? Oh, because you can't sit there. I don't know. No offense. There's no do not cross this line. You'll be executed or something like that. So he had to go sit in the house. Sometimes I think, wouldn't that be refreshing? Wouldn't you just love to be autistic for a day that way? I mean, you can see the players are all kind of hanging out there going, who the other kids? I don't know. must be the coach's kids, because no one lets their kid go down there, right? Okay. So that's social skills training. Of course, we mastered that with Mitch. So. But it is a very valuable thing, because one of the most salient things is if you can't function in society, you're not going to do it. So this is one of the things you can train people, even if they're never really suave and sophisticated like me. At least they can get by. They don't have to be perfect. They just have to get by. Parental support. Being a parent of a child with autism can be pretty isolating. Sometimes you don't want to go out in public. Sometimes your child does things which embarrasses you. Sometimes you don't want to take your child to the babysitter or a friend's house or a relative's house because they are burdened by your child. They don't understand your child. They criticize your parenting. They assume you're an awful parent. They assume you have an awful child. All those wonderful sort of things. So parental support is essential because the parent becomes exhausted. Parents become exhausted. And so being able to come alongside a parent and even just what I do in working with people, yes, I do my medical thing, but sometimes it's just being able to be there with them. I know what they're going through. I've been there. I am there. And a lot of times just being able to reflect that back to them and say, I know what you're thinking. I know what you're feeling. And this is, just to be able to make that connection without them having to feel guilty, feel awful. What if they feel hateful or angry towards your child sometimes? What happens if you feel disappointed or you are grieving because your child is not what you hope your child would be? Where do you go with that sort of thing? So sometimes that parental support is critical, and that's not just something that I can do. But if any of you become familiar with autism, you know a parent with a child with autism, if you kind of know more of the flavor of what it's like to have autism, then it's a lot easier for you to come alongside and legitimately and authentically be able to say, I can take over, let me help, because you know what you're dealing with. If you don't know what you're dealing with, then you're going to stumble. You're going to sometimes do unintentional things, which will be more hurtful, like trying to be a better parent. Okay? Being a better parent is not always a good thing to be doing. Educational support, that's what we're here for. No. Going also to the schools and things like that, he's trying to teach educators. It's amazing how slow progress has been. Most teachers go through training 20 years ago, and then they go to a few in-services along the way, but they've really never been given a very elegant description of what autism is like and how to approach a child with autism. Some of my most gratifying talks I've given have been to educators, because it lifts this veil, this burden that they have of not knowing what to do because they really don't know what they're dealing with. So how can you adjust your teaching, your method, if you don't know why the child is the way they are? If you give that educator a tool, you say, this is autism, they go, I get it. And so some of the best feedback I've gotten is from educators saying, thank you. For the first time, I have a sense of what's happening and how to respond. So I can respond in an appropriate way, which actually can be helpful, rather than just becoming frustrated and angry. So can you prevent autism? I hope so. And I really hope that down the road we're going to find some really good concrete answers to that question. Because we've got to do something. With that kind of staggering increase in the number of kids with autism, we better find out something quick. So avoiding chemical and drug exposure during pregnancy makes a lot of sense. We know there's a risk for that. We know that's the most critical time for brain development is during pregnancy. So avoiding things like drugs and alcohol and tobacco and potentially things like pesticides, obviously that's kind of becomes a big one. Since that's one of the known risk factors that we know about. Foods free of pesticides. That's going to be obviously with young children and the adults themselves, especially if they're in pregnancy phase, to try to avoid those sort of things. Does organic foods make sense? Yeah, it makes a lot of sense. Is that going to be easy to do? No. Is the food we just ate today organic? Anybody know? I mean, it's not an easy thing to do, and I know there are expense involved. But boy, if you're pregnant, knowing that one of the few links we may have is something like pesticides, it sure seems like a proven thing to do. Avoiding heavy metals. Well, thimerosal has been removed from most all vaccines, so the mercury in that is gone. It's been gone for 8 or 9 years now. Avoiding fish that may have mercury, especially during pregnancy or childbearing years, makes a lot of sense. Some of the highest risks of things like heavy metal exposure is going to be in areas of the country where they have smelters and plants and things like that, and they measure levels of mercury in the atmosphere that are downwind, I guess they're all travel east, and they have a higher risk of autism in areas where they're downwind, things like smelters and manufacturing plants where they release mercury and other heavy metals in the atmosphere. Considering vaccinations, it's always going to be a risk and a benefit sort of a thing. Again, for most kids, it's reasonable to vaccinate. Is there a risk? I think there is. It's probably going to be a very, very small one. I wish I could identify who's at risk, because that really will become the key of knowing whether or not to vaccinate a child. There are some vaccines you can avoid altogether, in my opinion. Chickenpox vaccine, nobody dies of chickenpox. If you had a question or concern about vaccinating with chickenpox vaccine in 1 year or 5 years, skip it. It's not a big deal. Hepatitis B, that doesn't have to be given in early childhood. It's done because it's the time which is most convenient for parent and physician plan to do it. Is it going to be a high risk if you give hepatitis B? I don't know. But if you're going to try to minimize things, and that's a priority for you, then that would be one of the ones that I don't think is essential in early childhood. Most kids get hepatitis B once they become sexually active. So that's not usually when they're 2. So what can you do? Well, coming here was the first good step, okay? Now, hopefully you're all going to walk away with just a little bit better sense of what autism is and what it looks like and the things you might be able to do when you see a child with autism or a family with autism. And also that you can start to become educated about being able to seek out answers and looking for ways of preventing it, looking at ways of developing resources for kids with autism, being sensitive to the need of families with autism spectrum disorders. If you can, don't wait to be asked to help somebody with a child with autism. Most parents are going to be very reticent to say, we take care of my child, I know he's a burden. So going out to them and offering to help before they come and ask you to help, before they're burned out, would be great. Just like anything else, it's sometimes hard to ask for help, especially when you're already burned out. Looking for opportunities to help. This is going to become, this is, and it's going to become a major social demographic issue in our society. It's no little deal. I mean, you're talking about, you know, one child out of 84, who knows how far out that number is going to drop. And again, if that's more right now in the age between 3 and 9 years old, push that forward 10 years. Okay, those individuals are all going to come out into society. If we're not doing something proactively as a society now, then we're going to be in big trouble. And we already are. Most government agencies already recognize we have almost no services for adults coming out into the world with autism. Our son's 19. He leaves high school this year. So we know firsthand, again, the very limited number of opportunities we have. I mean, there's very, very few out there. So we should be preparing for this. You know, right now we're really not. So to support those who are helping children with autism, that's us. Okay, sales pitch time. We are the only comprehensive treatment center for children with autism in the Tri-Counties or beyond, actually, if you look almost anywhere in the foothills. Most treatment for autism is centered around seeing a doctor. You see a psychologist, you see a nutritionist, you see a speech therapist, you go to the school, that's where you should get your care. But those are fragmented types of care, and so to be able to come to one place, again, for a burned out, exhausted parent, to be able to come in and plug in and say, we can take care of you. We can do this, we can do that, and we can communicate with one another. We can engage with your school, we can engage with your spouse, we can do all these things for you, because parents with children with autism are wiped out. They're burned out. They're disillusioned. They're grieving. They're going through a lot of emotional stuff. And if it happens anything like it happened for Kim and I, you go down, you go to the Mind Institute, we went to Illinois, we went to a psychiatrist in Sacramento, and they give you this long list of things to do. And you say, well, where do I do those things? Well, there's a social skills training group in Pleasanton that meets on Thursday night at 6:30. Oh yeah, that's what we're going to do. We're going to drive an hour and a half with an autistic son screaming in the back of the car, and an hour and a half to Pleasanton once a week to do social skills training for 45 minutes to drive home. Oh yeah, put that first on the list. And then put all the other things behind that. A doctor who has 15 minutes and has this much interest and this much knowledge on autism, and you're going to go see him. Okay, they'll pat you on the head and give you another list of things to do and go out the door. What they really do, they need an investment of time, they need an investment of resource, and it needs to be accessible to the individuals, and they won't do it because it's just too cumbersome, too overwhelming. So that is what we are and hope to continue to be to the community here, is that kind of a resource where people can come kind of for one-stop shopping, and to continue to do this kind of a thing where we can educate the community about what autism is and why it is important. I mean, is it just a little deal or is it a big deal? You know, obviously we think it's a big deal. So thank you for your time, thank you for your interest, and if you have questions, please just let me know. Yeah. Oh. Question?
Has any study been done showing where there are pesticides, that there is more autistic children?
Yeah, I think when I mentioned that, there was a study done by Department of Developmental Services in California, Department of Health Services, DHS. 11 counties in California, mostly near Salinas. That's where closer to a farm field, that those mothers who were pregnant had a 6-fold increase in having autism. They did another separate study done in the Midwest that showed similar results with the same types of pesticides called organophosphorus. Yes?
I have a question about the seizures. My grandson is 15. He just started having seizures. And I'm not quite sure what to expect. And the doctor here at this point, getting connections and stuff, he's on anti-seizure, but he's still having them. So they changed
Does he
medication.
have autism?
Yes.
Okay.
Oh, yeah, he's
Yeah, you can develop seizures with autism anytime, or usually by age 20. They can happen anytime where you develop the seizures. And you're asking about the medications?
well, that or expectations, I guess. Is this something, once it starts, it's pretty well permanent? Or always has to be medicated, or?
Usually, once you have seizures with autism, you continue to have seizures. Yes. There's not a lot of good evidence, I know, of things that change the course of that. Any questions?
How do you feel about the new program of Mark Twain? They started a new program where they have an autistic program.
You're talking about the new program working in elementary?
Mark Twain Elementary, yeah.
Okay. Well, some schools have become smart lately as far as developing classroom environments where kids with autism do well. There's always been a push to mainstream all children with autism, and that is the goal. We want to have one mainstream class. It's not always a very functional, nor is it a very positive result for the children with autism. You put them in a classroom with 30 kids, you have this tremendous social thing going on. They become very frustrated, very angry, and do a lot of acting out. So what ends up happening is they blow like a fuse in the regular classroom, all because we say we can prove that we can put them into a mainstream class. So it's not always a good environment. So oftentimes putting them in a special class with the kids with autism is a very good thing to do, especially for those kids who really can't function well socially or otherwise in a regular classroom. One thing is a good example. They're starting to work with that kind of thing. Brett Hart had a very good program they developed a few years ago. There's another good one in Sonora, Curtis Creek Elementary, where they try to design a classroom which is going to be autism friendly. It will be very helpful. And they integrate the social skills into that. Yes?
You said support Mind Matters. I mean, does that mean, be specific though. Does that mean donations? Does that mean volunteers? I mean, if you were going to empower us to help you, what would it be?
I think, obviously, financial donations are a big part of it. For us, a lot of the services that we do are not covered by insurance. Typically, physician services are covered by insurance. Some of the other services and counseling services might be, but a lot of the things that really help for children with autism are not covered by insurance. So we end up either having to turn people away or looking for funding to try to support it with scholarships right away. So really funding is a primary need for us. We do seek out grants, and we've gotten some pretty good grants in the past. But it's kind of an ongoing process where we continue to need to find some type of financial support. I mean, many families with children with autism don't have a lot of resources, and that's just the nature of the beast, so we need help with that.
Are there any new medications, and are you familiar with research done with oxytocin?
With what?
Oxy, it's O-X-I-T-O-C-I-N.
I'm sorry, what?
Oxytocin,
Oxytocin? Oh.
And they're using.
Yeah, there's been a lot of things that have been tried. Oxytocin, which is the hormone that goes from the brain to the breast, has been used in children with autism, and it shows a transient improvement in their socialization and things like that. What they haven't been able to do is show a way which you can do that in a continuous way, which shows continuous benefit. They've done that similar things with some other, there's a lot of little treatments out that they tried, but none of which have really been good to be used on a long-term basis, showing sustained benefit. Oxytocin is fascinating. It kind of tells you, okay, how does that connect and what's the piece there? Just like working with the gut, they did a study where you use a certain antibiotic which killed off a certain type of bacteria, and they transiently improved. This improvement could last for a week or two, and then goes back to where they were. Why is that? It tells you something's going on with the gut. So there's pieces like that, but nothing that we really can say we can do this long term.
There are no new medications out.
There's no new medication out there that's being used right now that shows any sort of long-term promise. No. I'll work earlier. Well, is there more about this? But the question is MMR, why did they put all three in the same vaccine? And the question of MMR vaccine, the concern was that a lot of children with regressive autism, that's when they tended to regress. It was around the time the MMR vaccine was given, between 15 and 18 months. And that's oftentimes when you see children go through this regressive form of autism, which is very scary. Certainly makes you think could the vaccine be an influence in that. And that's where the marisol was also in, was with the MMR vaccine. The reason they were all combined together is for convenience for the physician to get, instead of 3 pokes, 1 poke. Yes?
My 3-year-old granddaughter asked me to squeeze her when she's going to sleep. She wants you to take her arms, her legs, her fingers, her feet, hold on, squeeze pretty hard. Is that helpful, beneficial to them? It seems to soothe them.
That's called sensory sleep. The question is, her granddaughter likes to be squeezed to help her go to sleep. It seems kind of an odd sort of thing. Temple Grandin, who's a famous author in the autism world, used to do this thing where they get the squeeze box where you put a cow when they're getting ready to get vaccinated. She developed this thing to squeeze the body into a squeeze box. It's called sensory seeking, and it can be very calming to a child with autism. They have weighted blankets they put on children with autism, same sort of thing. They like to be held and squeezed sometimes. So for some, it's very soothing. It can be a very good thing.
Good question. My granddaughter also doesn't eat. She has terrible food. I guess we
She
should.
does. Weird foods.
Oh, yes. We're not supposed to talk about
Yeah.
that. Is there any list of foods that you recommend or diets? Because they've tried various things like gluten-free. Is there
Well,
any?
if you're trying with the gluten-free, gluten-free diet's always a reasonable thing to start with. Beyond that, actually, I do what's called a comprehensive digestive stool analysis. You look at everything about poop you never wanted to know. And actually, you analyze it to say what's wrong with the poop. And if you can find out what's wrong with the poop, then sometimes you can have supplements that help the body to digest the poop better. I'm a poop specialist, by the way. And kids, autism, I talk about poop. What's the voice? Thank you.
I would just like to thank everyone for coming and also let you know that the healthcare district is the sponsor of today's program. And in your honor and in appreciation of your speaking with all of us today, they will be presenting a $1,000 check to my name.